You're listening to Psych with Mike. For more episodes or to connect with the show with comments, ideas, or to be a guest, go to www.psychwithmike.com. Follow the show on Twitter @PsychWithMike or like the Facebook page @PsychWithMike. Now, here's Psych with Mike.
Tongue depressor. And look in the throat and say, you have cancer.
That's right. Welcome into the Psych with Mike Library. This is Dr. Michael Mahan, and I am sitting here talking with my friend, Mr. Brett Newcomb.
Once again, dear friends, into the breach.
Once more into the breach. Yes. Unleash the hounds of war.
Yes. Cry havoc.
The dogs of war. Cry havoc and unleash the dogs of war.
There you go.
Yeah, I'm not very good on my Shakespeare.
Okay.
Are you?
I once was.
Yeah. I never was. But I am really impressed by people who are.
I once was.
I'm really impressed by that then.
All right.
So I think I have a scratchy throat.
I remember when I was in college, we had Randolph Churchill come to our college to do a little presentation, the son of Winston Churchill. And the presentation that he was going to do is kind of like a sleazeball pianist in a joint.
Not to be confused with Boots Randolph.
No, more to be confused with Bill Murray, being the lounge lizard. But Randolph had this shtick that he did where he played a little piano and he would tell funny setups, the punchline to which was one of the 33 Shakespeare plays, comedy strategies, what have you. And so he'd do the little song and we were supposed to shout out, As You Like It, Tempest, whatever, Julius Caesar. And so we were in college in Central Arkansas in the 1960s, late 1960s.
Yeah.
And I have to tell you that 200 people in the room, after the first 5 minutes, the only person that responded to anything that Randolph Churchill offered was the English literature professor who was sitting in the front row.
He knew all the answers.
He knew all the answers. Nobody else knew any of the answers. People wanted to shout out football scores,
right,
but they didn't know anything about Shakespeare.
So
that is from whence I came.
When the professor would start to shout something out, would everybody else like mimic him so that they would look smart?
We felt relief that someone was right. Someone in our college.
Because Randolph wasn't going to stop until he got the answer.
Apparently not. He'd already been paid. He could have.
Yeah.
But he was very gracious and very polite and acted like he didn't understand that we were all ignorant and hillbillies.
Well, somebody should have elucidated
vetted that somewhat before they hired him.
You would think. But
you would think.
Well, I think
they were the audience. Like here's a cheat sheet of all of Shakespeare's plays.
Well, that would have been helpful.
You can, guess at some of them.
Absolutely.
But if you just have to recall them somewhere, not having read them.
So how many are there?
33, I think. But I had read maybe 5.
I was going to say, I think I might know 5.
Yeah. That'd be an interesting question to ask people randomly. How many Shakespeare plays can you name? But anyway, that was an embarrassing moment in my college life.
I mean, even if you got to 12,
you have to understand, I wasn't embarrassed about my own ignorance because I understood why I was ignorant. I was embarrassed about everybody else being so stupid. Yeah.
Poor.
Yeah, all those other people. Is that projection?
Yes.
Yeah.
So I feel like I have a scratchy throat.
Yeah, but you do that whenever you don't think you know what's going on. If you have some physiological problem, a temperature, a fever, a cough, a scratchy throat, a pain in your foot, you are a hypochondriac.
So whenever I'm trying to cover up my own anxiety.
I think that's what they call it. Yeah.
So there probably could be a lot of that going around right now, don't you think?
Oh, I think there's an increased amount of it. People, more OCD stuff and more hypochondriacal stuff. Because OCD will tend to be a magical attempt to micromanage and control everything in order to prevent risk.
Right.
And the hypercondriasis will be a worry about the risk that you can't control or don't know is there. Like, if I touch this, will that happen?
And in an extreme form of OCD could be a conversion disorder where you actually create psychosomatically the disorder in your physical body.
Like a paralysis or a blindness or something like that. Yeah.
Yeah. So
So conversion disorder of blindness means that the mental parts inside your brain that connect the vision that comes in from your eye along the optic nerve don't translate it into a message that your brain recognizes.
Right.
So if you have gone blind as a result of conversion disorder, and I flick my fingers in front of your eyes, you'll blink or move your head, but you won't be aware that you saw anything happen. You won't have seen my fingers coming towards you or me standing there because you're blind. But you're not really blind.
Right.
And often with conversion disorders, you go to sleep, you wake up, it's gone until you become anxious again, and then it comes back, or until you remember you're not supposed to be seeing things, and then you're blind again. It's a mental thing. It's not a physiological thing. And like sometimes it moves around your body. So you're blind today, but tomorrow your left leg will be paralyzed.
Right.
Until we can address whatever the underlying fear and anxiety is, guilt, whatever it may be, the motivating issue, resolve that, then it goes away.
And what I'm afeared of is that there are a lot of people, because testing is still sporadic for coronavirus, COVID-19.
Intentionally so, might add.
Well, I would hope not, but that there are a lot.
I believe the President of the United States has said we don't want to know those numbers, because if we know all those numbers, then we know all those numbers. So we don't need to test.
Well,
we just need to go back to work. And people die. People die.
I'm afraid that that's also part of the motivation, is that we don't want to know what the actual numbers are, because we might find out that 33% of the population has been infected, and so then nothing that we did
with
really.
Coronavirus or Trumpism?
Okay, with coronavirus.
Oh, okay.
You're going to keep on tempting me to do this political thing, and I'm not going to do it. But
maybe you'll go blind.
Yeah, I very well could, or deaf.
Yeah.
But you know, we've heard we've heard
hypercondriasis now.
Many anecdotal stories of people who, you know, were afraid that they had COVID-19 symptoms, and they got tested and they were negative, and then 2 weeks later they were positive. And the question is, what's going on there? I mean, did they originally ever have it, or did they get it later? I mean, and this is what I'm concerned about, is that I think that because we don't have good, adequate testing, there are a lot of people who may be very, very anxious about this, and they may be developing a
psychosomatic.
Yeah. And now, for anybody who may actually be exposed to coronavirus and believes that they might actually have COVID-19, I'm not saying that you're lying or faking it. I don't want anybody to perceive that. But I also am concerned about the overwhelming majority of people who may feel very anxious, may be very worried about it, you know, and thinking, oh, I can't go outside. I must wear a mask. I must wear gloves. And if you want to do those protective things, I'm doing those things. I'm not saying don't do those things. But not everybody is necessarily going to fall prey to the coronavirus. And so what we want to do is we want to be able to manage our anxiety over this issue as best that we can.
Well, and I think it helps if there's honest agreement on the terminology that's used in the media. When the message of wearing a mask is put out, it needs to be put out clearly. The wearing of the mask isn't to protect you who are wearing it. It's to protect those whom you might inadvertently expose to a deadly virus. So it's you protecting others. It's not you being weak and trying to be afraid and protect yourself from this thing that might be out there.
And so that is a good thing to do, and I will do that.
Yeah.
Even though I'm dubious of the science, I'm not going to argue with whether or not it's effective or to what extent it's effective. If it is even 1% effective and people feel like that it's a good thing to do, I am totally comfortable with doing that, and I am doing that. But I also don't want people to believe that if we don't all wear masks, we're all going to get coronavirus, we're all going to die.
Well, no. And that's not what the science shows. I'm curious why you would say you're dubious about the science. What are you dubious about with regard to masks.
Well, because so this is this is, I think, the science, and I'm not sure that anybody would argue with this. So the mask would prohibit water droplets of a certain size from being able to be projected through the mask.
Right.
But the actual virus is microscopic. If you can breathe through the mask,
it's contained in the water droplets.
But if you can breathe through the mask, you're going to aerosolize the vapor that's coming out of your respiratory system. And that's going to be droplets that are going to be small enough to pass through the mask.
But if we're both wearing masks, then it has to pass through two sets of filters.
But so what it means is...
Which reduces the opportunity.
It reduces the area of influence. So it reduces the distance with which I may be able to project those water droplets. So instead of 3 feet, maybe it's only going to be projected a foot. But still, virus is going to be shed from a person who is respirating that is infected.
So
even if they wear a mask.
Right.
And so, but again, which
is why they're saying, wash your hands, don't touch your face, don't touch your eyes, don't touch your nose, don't touch your mouth. Because if you go to the gas station and try to fill up your car and you don't use some kind of protection, you could get the virus from somebody who was there 10 minutes earlier. And then you put your finger in your eye or you chew on your fingernail and you ingest the virus. And you got it. And not only do you have it, but you're a spreader for the next 10 to 14 days.
Absolutely.
Before you're going to get sick from it.
And so I want to do all of those things.
There are modifications that we have to make in order to protect others.
And that's what I want to do.
May not protect us.
That's what I want to do, is to make the modifications that are going to protect the society at large, my community in specific. And I want to do those things, but I also want people to be well informed and to not be anxious. So what I keep saying is, be smart, be safe, but don't be afraid.
So you say that to people that are hypochondriacal or that have conversion disorder?
Or both.
How do they respond?
Yeah, well, they're going to be irrationally resistant to that message. But that's why I want to try and promote this to the best of our ability is, some people are not going to want to hear this, and that's fine. And some people are going to want to hear, we now have people carrying carrying loaded weapons into the state capital of Michigan. And then we have other people who are saying, if you leave your house, then everybody's going to die. This is Armageddon. So we also
have people that are going into Walmart and then shooting the clerk that says you can't come into Walmart without a mask.
Right. And so that's what I'm saying is that we have very different perceptions.
You better not worry about the virus. You better worry about my bullet.
Of how we're going to experience this based on where we live and what our perception is. And I want to...
And the perception of our community.
But I want to promote, is there a way, my message is there a way for all of us to agree to come together in solidarity? Could we all just say...
We all hold hands and sing, "We shall overcome"?
Well, we can't hold hands, but...
Darn it.
But could we...
What can we hold?
Well, could we agree...
Our rifles.
That it's okay for all of us to do some things to help protect the community, but also recognize that the probability that we're going to be able to get through this,
it's not a guarantee,
without a certain percentage of the population becoming infected is not realistic. And that's it. I don't want to say that that's okay, but that's a reality.
Well, because we know some other realities. We know that there are some elements of the population that are at greater risk, like the elderly, or those in nursing homes, or those in prisons, or meatpacking plants. So it's not just randomly everybody in the universe. It's very specific locations for very specific reasons. And if we can do whatever we can to minimize those reasons or our exposure to those reasons, we increase our own likelihood of avoiding it, but we also increase the likelihood that those near and dear to us will avoid it. And I think that's what I hear you saying is your goal.
And exactly. I mean, so you know my son. My son has struggled with being very conscious of germs and things like that in the past. He works for Amazon. And he works in a high-risk environment. There have been people in Amazon facilities that have clearly tested positive, as far as I know, in every state where there's an Amazon facility. And he works around a lot of people. And he is very, very pragmatic about this. You know, I use all of the safety precautions that Amazon tells us to use, and I try and be conscientious of my fellow workers, but I don't walk in afraid. And
good for him.
Yeah, and I am so proud of him that that's his attitude, and that's the attitude that I would love all of us to be able to have. And so if we have this fear, oh my gosh, we could get this, and you know it could be horrible, and we might not survive, then here's my thing: if you are a hypochondriac, or you have an OCD issue that leads you to manifest that as a conversion disorder, you significantly increase the probability that you're going to be susceptible to the virus.
Yeah.
And that's just a fact. That's just a medical fact. And so what I would like would be for people to not be afraid. We can all take protections, and we can then go through our reality and try and manage this to the best of our ability, recognizing that a certain percentage of the population is going to get infected. We want to try and minimize that to the best of our ability, but that's just a reality.
Yeah. I think that's the only reasonable, sensible approach to have. Otherwise, you get hysteria.
Yeah, exactly. Yeah. And that's right. The third component of what the title of today's episode is that, you know, if we allow ourselves to fall prey to the hysteria. So the question is, how do we defend ourselves against hysteria?
I think if you're prone to being subject to hysteria, the most immediately useful suggestion I would make is stop watching the news. Because the news media are so polarized, and they're so in all caps, no matter which side of this thing that they're on, that what comes through is an invitation to hysteria rather than information for making decisions and having judgment. So, you know, if the music starts, don't dance.
Mm-hmm. And what I have believed we've really been messing in this most recent episode is a consistent, strong leadership. You know, you were talking about that you had this experience where Randolph Churchill had come to your school, and obviously his father was Winston Churchill. And, you know, when we've had episodes in the past where people have been able to transgress or get through really hard times, one of the qualities I think that's probably fairly ubiquitous if you look at the history is that when that has happened, when people have been able to get through those difficult times successfully, there's been strong leadership. And I don't know that we've had that during this most recent episode. Some people may think that the leadership we've had has been strong and been wonderful. And
I would use other modifiers. I mean,
okay.
I hear you saying strong leadership,
okay.
And I think that good leadership is better. I think good leadership will be strong, mm-hmm. but I think just being strong doesn't necessarily make it good.
Well, and so now that you say that, I'm hearing myself, and I'm want to modify it myself. I don't know.
Don't just follow the loudest voice.
Yeah. Don't but the messages haven't been consistent, right? Masks were not good until they were good.
Yeah.
And, you know, we didn't need testing until we did need testing.
Right.
And then we needed testing until we didn't need testing.
We weren't sick until we were dead.
Yeah, and so I don't feel like that there's been a consistent messaging anywhere through any of this that has been credible enough for people to feel.
So, realistically, in the United States of America, we are such a heterogeneous society. Different regions, different realities, different geography, different resources, different levels of education, different levels of income. it's hard to lead such a conglomerate of differences. And to lead it well is harder yet. So right now, in the middle of a national crisis or an international crisis, I would encourage people to look for those qualities of leadership that don't just have intensity, but have virtue in terms of being evidentiary, being organized, being consistent, being persuasive, and modeling admirable behavior. The way that I would say lead is model and articulate clearly, thoughtfully, with information and not just opinion. I mean, I remember in school many years ago having assignments that were focused on learning the difference between fact and opinion. We had to read all these different things and go through and label every fact and every opinion to try to internalize that lesson. I
don't know we know that anymore. Yeah, I don't know that we know the difference between a fact and an opinion.
And I remember being taught in school that reporters were supposed to do who, what, when, where, why, and not editorialize. That the editorial page was to editorialize. The reporting information was to cover those facts. And all the media that I have access to now seems to cross that line where the reporter, the ostensible reporter, is also offering his or her opinions, which to me invalidates much of what they're trying to present, because we have a tendency to follow the people that believe what we believe, and that's about opinion,
right?
Not about fact.
It's about confirmation bias,
and so it's hard then to find objective facts. So, in terms of the topic today that we're talking about, the hysteria, I would say probably one of the best short-term bets is to just not watch the news every day. Watch it for a minimal amount of time every other day. Just to stay on top of whatever the current crisis of the moment is, in case there's something that you need to attend to. But beyond that, let it go.
And we've been advocating that since the very beginning of this whole entire process, that we would prefer that people watch the news less. There isn't anything on the news that's going to protect you.
No, it's going to confirm your bias. It's going to arouse you. It's either going to
confirm your bias, or it's going to make you anxious. And the more anxious you are, the more susceptible you are to, there's the duck, the more susceptible you are to being infected. And so I just really want to try and promote a message of being smart, being safe, but not being afraid. And I would like for us to be able to find some kind of behavioral pattern that we could all agree would be okay for us to adopt until this has blown over. I'm not looking forward to wearing a mask in July when it's 110 degrees outside, but I'm going to do that because I believe that modeling that behavior is a good thing to do. And if it even increases the probability of safety by 1%, I am all for it. I wish that we could all come together and agree on some kind of standard of behavior that we would say this is okay for us all to get on board with until this is over, but we're not going to be afraid.
So we don't have control over any of that.
No.
We have control over what we do.
I know.
And I'm mindful of the old Chinese proverb, since this is a Chinese virus. The journey of 1,000 miles begins with a single step. We can take a single step. One of the single steps that we can take is to minimize the amount of exposure we have to hysterical news media. One of the steps that we can take is to learn to get centered, to mediate, to calm down, meditate, calm down. So if I practice meditation to calm myself down before I'm exposed to information that might agitate me, I'm less likely to get sucked up into the vortex of hysteria when I encounter the information.
And then that's going to make you less likely to fall prey to hypochondrosis or conversion disorder.
Or any other mass hysteria.
So
those are two little steps that each of us could take to our need level.
So let's say that people do want to take those steps, but then they see lots of other people in their environment or on the news when they are watching it who are not taking those steps, and then they're upset about that, then what do you do?
Turn it off and meditate.
Yeah.
Calm down.
Yeah.
Reality test. What can I do about that? What can I do today about people protesting in Michigan?
Right.
I'm not in Michigan.
No.
So what I can do is make sure that I have checked on my next door neighbor, see if they're ill, if they need anything, that I have calmed myself down, and that I'm not getting frightened about my degree of risk because I haven't been anywhere to do anything to encounter the risk.
Exactly. I agree with that 100%. Is that
so
we
I have
have
the freedom to go out. I also have the freedom not to.
Right.
Hello.
That's right.
Yeah.
Exactly. Now,
I'm here.
At some point, I do agree that it is a good idea to start to try and reopen the economy, because what we don't want is to completely shutter everything to the point where we're in a worldwide depression.
But then these memes that you see on social media that are clever, that make a point, but may not be good for our civil discourse. I saw one this morning before I came out here. It said, oh, so your kids need to be in school, and it's safe enough for your kids to be in school. However, it's not safe for Paul Manafort to be in prison.
Okay.
Yeah, so send your kid to school. Maybe they'll die from the virus, but Paul needs to not be in prison because it's a dangerous place to be.
He's got some health risks.
I understand that. I'm just saying it reduces the thought process and the information content to a slogan that doesn't require any thinking. It just requires an emotional, visceral antagonism.
But that's what makes it powerful, is that it locks into the emotion. So you're saying people need to avoid getting trapped by... Okay, and I agree with that 100%. Yeah. The internets are fantastic. Thank you so much, Al Gore. But they're also...
and thank you to the Russian bots.
They're also potentially very hazardous, because they do lock us into this perception that we're getting information, but we're not questioning the source or the validity of the information. Right. And that's a big problem. So I don't know if we're making any valid points here, but this was something that we wanted to talk about because we both feel very strongly about these things. And if you don't agree with us, let us know.
If you don't want to do your own thinking, let us think for you.
There you go. Yeah. We'll always lead you in the right direction.
There you go. Because that's what leadership's all about.
So all the music that is on Psych with Mike is written and produced by Mr. Benjamin DeClue. You can always get a hold of us at psychwithmike.com, where you can get additional episodes. You can contact us if you're hearing us either on I-10, the Positive Voice of the Desert, or on the podcast. Please go to the iTunes and the YouTubes and subscribe and give us a like, give us a comment, and we would really appreciate that. If it's Friday, it's Psych with Mike.